Okay, good evening, everybody. Okay, I'll mute everybody. So we are back. This is our little break. We took a little break for Ramadan and also Raya. And yeah, we are very happy to be back on the Ask the Experts session. Actually, it's brought to you by Fit Unit and PRKPP to basically have a well-informed community. We keep each other entertained and educated as well regarding mental health, regarding physical health, and we discuss a lot of topics. I think since last year, I think we have done more than 30 weeks of sessions. And the last session that we had, okay, the last session that we had, okay, there's also a few coming in. All right. So the last session that we had is actually, let's see. Okay, this year we have done the last 8 sessions. We have 2021 resolutions. We have making the right decision. Are we angry at COVID-19? We also talk about understanding and managing your emotions during the pandemic, emotional intelligence, manage your emotions, having a new mindset, and also sleep hygiene. So we're definitely on the right track now that we are not going anywhere further than another lockdown, more tighter SOP with the cases rising. So I think we were discussing, Prof and I, we were talking about how to overcome, there is certain things that we are facing now, which is the Zoom fatigue. Even being in front of the computer, we are so tired of it already. We need human connection. So we have something called pandemic mental fatigue. So today we're going to talk about that. Just to introduce myself, I'm Felicia, and I'm actually a fitness and lifestyle coach. And together with us is our friends and associates of good lifestyle, education, mental health, and in various different fields. And also we have our regular Prof Mohammad, right? And he is our mental health expert. Okay. So yeah, the floor is yours, Prof.
Okay, thank you, Felicia. Assalamualaikum warahmatullahi wabarakatuh. A very good evening to everyone. Thank you for being with us tonight. And I hope we also have all the listeners in the Facebook Live. So today, the topic, myself and Felicia, we decide to talk about mental fatigue. Not only just mental fatigue, we also go into physical fatigue and situation that is coming in now almost after a year or so. It seems that the third wave is even getting more and more worse with 3 different variants of virus mutation. Mutant virus is coming out much more serious effect and death is higher now. Never seen before in Malaysia, the death number has gone about 40 to 50 in a day. So today I'll be talking about this topic, mental fatigue. But before that, let me just start on, share my slide. Okay. Okay, I hope you can see the slide. All right, before we move on to talking about this topic, mental fatigue, I think we need to recapitulate what this situation is all about. As you know, we have gone through more than a year of a stress situation. Initially, it was just an acute in nature. Now it has become chronic. So as you know, stress is when we perceive there is demands or threats towards ourselves, our ego self, our mental self in that sense, and also towards our body. So once we perceive that, obviously it will affect our mental, it will affect our physical, our emotional, and our behavioral action towards it or reaction towards it. So basically, as you know, the usual common response to stress is either you actually try to manipulate the stress by fighting against it. so that you can maintain your normal self and normal situation that you are in, because your body is ever ready to fight it. But unfortunately, for some people, they are not able to, because maybe they are lacking in quite a number of things within themselves. Then also the lacking in the external factors that could actually make them able to fight the stress situation. So they may end up with flight, that means running away from the situation and trying to avoid it. So these are quite a common sympathetic reactions when we actually start to actually face the threats. So we are ready to fight, and that's when our hormone cortisol comes up and our sympathetic reaction overstimulated. And subsequently, as you know, now there is another response which possibly people did not talk much. Beside either we can fight and where we engage with the threat and we were able to maintain ourselves because we might be able to win the fight, or we go into avoid the situation, we leave, we run away. That's called flight. And our situation, since we flight, we are not actually able to handle the problem. We may actually experience what we call grief. But some people actually they experience what we call froze or freeze in that sense. They were not able to do anything much, and this is where they were considered as like inability at all to respond to it. And there is another fourth F that we call it, whereby in this case not only the flight or the fight and the freeze, but they also has what we call the fawn, where subsequently this is a situation. Sometimes I use the word F. This fourth F is flow. They just follow what is going on. It's like if they are drifting in a boat, they don't even row the boat either to go to the sides of the river, but they just flow according to what is being taken to them. So just want to give you what they are in a fight situation. Obviously, you may have anger, you may have frustration, you may cry about the things, but you're still able to actually deal with it maybe. But when you fly, you actually become, you get away, you're trying to become more nervous, you become more fidgety, and you're trying to avoid the situation. When you have what we call the freeze response, you become numb, you become helpless, hopeless, you don't know what you want to do, right? And you may have a physical complaint and you become indecisive with regard to the way you respond to the problem. So this is another aspect that you can see when somebody has actually responded to the acute stress, which is rather much distress to them. They tend to actually become isolating. They don't know indecisive. They feel unreal. They become depersonalized. They may have a problem like they space out themselves away from others. Right, and the fourth element is that they were trying to perform, but a very superficial level. They were not really able to go deep. And this is where they try to just survive, basically, not able to perform very well. As you know, the fight or flight reaction, it involves all the systems, organ systems within ourselves, the blood flow, the eyes, the hormones, the heart, the lungs, and the GITs, and all are involved in the reaction. So these are all a slide that can tell us what happens when you are actually sympathetic overdrive, or what we call overreaction. I think all of us are very familiar with this acute stress response. And here is another graph. It's very important for us to look at. Whenever the stress level is getting more on the x-axis, as you can see, a low stress, obviously we can still manage it. Performance is able to still handle the problem. So the graph appears to going up, but along the line, when it is we still able to cope with the stress, obviously we start to drain our morale. We start to actually give us that fatigueness within ourselves. We reach to a particular level where we can still perform, the optimum ability to perform. For some people, if you were to look at that tip of that slope or the graph, you can see that is the maximum level of stress that you can go. Then beyond that level, then you become exhausted, you become breakdown, and by then you already have achieved what we call an overload of this stress situation that you are, and that brings down your performance, and that's actually show you that from stress situation, once you cross this line to the when you cross down to the optimum line, you become distressed. And once you become distressed, obviously, a lot of psychological complication will come in. So today we are talking about mental fatigue. Just let me tell you what it is. Basically, the definition is your mind is already very tired, very excessively tired. I think most of us have gone through that stage now. Because we hope that initially things will die down, especially when there was a glimmers of hope with the vaccine that comes along. We thought that there is no more threat of this nature, but subsequently we even realized that most likely even the vaccine doesn't have much, because even those who have vaccine twice the dose or the second dose, they still have some, they're able to still get infection, and some of them still succumb to the problem. But fortunately, the vaccine will actually reduce the seriousness of the effect. But still, the danger is there that we still can get into the infective kind of a nature. So obviously, our mind become confused now. It become more and more tired in facing all these that we have, and again, in and out situation kind of a thing. Initially, we thought we can be more free. Now we have been pulled back to be again in the lockdown. So because of this so-called instability, because of these changes that we are going in and out situation, that's where a lot of people are experiencing some kind of a situation where they might actually have what we call just flow with the situation, and they don't really able to do anything much anymore. This is what we worry when people are reaching the level of fatigueness. And most of these actually they go into the situation whereby we can see the effect of stress leading to fatigueness, whereby problems is getting, even small problem is getting worse to them. We see that performance has been reduced, productivity has been impaired, and personal and physical functioning is also being impaired. So if you were to see, these are the things that we can actually take note in terms of mental fatigue. Usually we have what we call the day variation. In fact, maybe it's worsened in the evening. In the morning, we still not too bad, but when we are actually getting more and more fatigue for the day, it has worse and worse by the time. We have difficulty with our focus, with our concentration. We take a longer time to actually get back to our normal ability. So there's a long recovery time sometimes whenever that we face another added complication, we're not able to come out of it very well. And usually it drains your mental energy. And along the line also, we have others issue. We are quite sensitive. We're sensitive to a lot of situation that we are in, and we become more and more irritable. We maybe to some who has experienced a lot of these so-called issues with regard to this lockdown and of this nature, it will affect them much more with regard to their thinking, with regard to their memory, with regard to their initiative, and with regard to their moods and their sleep. So this could affect, and that is actually the signs of mental fatigue that has come in. So if we were to see this emotional fatigue, or we call it a sign of emotional exhaustion, that means fatigue has gone more and more serious, where actually you are losing your patience, you have sleep problem, you become more and more irritable. You may end up now with anxiety and depression, you become unmotivated, you become detached, you become depersonalized, or sometimes some people even reach to the level of derealization. That means the external world appears to be like they are in a dissociative situation. So here, if you can see the strategies, what we can do, one is with regard to the cognition, the way we see things, and with regard to our behavior. So we can go into what we call cognitive behavior therapy, and the idea is basically to decrease the negative cognition, the negative thoughts, which bring the negative emotion and which actually leads into negative behavior. The other strategies could be energy conservation. Obviously, we need to have more rest. We need to actually delegate the burden. Unfortunately, not everyone has that ability, or not everyone has that opportunity. Obviously, they are stuck in a situation right now. We were to see some group of people, some different, like the elders and some people who are not really well in terms of their socio-economic standing, in terms of their work and things of that nature. Maybe they were not able to actually use these kind of strategies. But if possible, each and every one of us should have some element of rest, should have some kind of medication with regard to their emotion, some kind of, occupational therapy, where we can see whether we can offer some kind of a proper task for them. And like quite a number of time now, we heard that a lot of our, agencies are giving them some new opportunities. Also, then we need to actually institute physical therapy, exercise, and also stress management kind of a situation where here we can promote relaxation techniques. So prevention and solution, obviously, as we said, exercise is very important with regard to fatigue as a fatigue remedy. And according to that, obviously, exercise is just a low intensity exercise can decrease the fatigue to up to the level of 65% and boosting the energy and the motivation. And on top of that, again, most of us possibly has issues with regard not able to rest their mind very well, so they are not able to sleep properly. So sleep is very important, and relaxation that could actually help them to overcome the fatigueness. Obviously, other situations like trying to break away, do some kind of relaxation with vacation or visiting family. All these are out of the picture for the moment. So we may get stuck in what in our own homes. So now I think the situation is getting worse for each and every one of us. As what Felicia said, even for myself and my colleagues in the college, we are getting more and more, how should I say, distressed, because our timetable has to again be reshuffled with regard to the teaching. The student has to delay again in their activity. So these are all giving us a lot of stress situation right now. And also we are talking about physical fatigue. Here we can see the physical performance is decreased. The muscle also appears to be aching, and the energy is getting to be diminished or reduced. So these are the physical kind of aspect of fatigue. So fatigue will go into much more worse situation, and the term is exhaustion. This is where the fatigue has become extreme, whereby obviously the ability to perform physically or mentally has been very reduced. So once this exhaustion has gone beyond the ability to get back to normal self, that is where the situation is called burnout. Right? So what is burnout? Again, that is this exhaustion, emotional, mental, and physical exhaustion, which is caused by excessive and prolonged stress. Now, all of us are very worried about all these new variants because we are seeing our own family, our own friends are getting into the situation whereby we were not seeing that before they were actually at risk. Now it appears to be even those within what we call a person without less risk are getting into the situation with this infection. So we heard about these three variants, or then we are seeing how this virus mutation and causing this variant in the virus ability to actually assault a human. So we are worried about the situation that could affect us all. So as the stress continues, obviously we're going to lose a lot of things, lose interest, lose motivation, lose ability to actually get out of the situation. And we are worried that people are telling us that the numbers are going to be increased more. So if we get new cases by the 10,000 or so in a day, obviously we are worried that will happen that we can be involved into the situation too. But unfortunately, for those who have actually reaching the level of helplessness, sometimes they couldn't be bothered anymore to take caution. This is where they actually become more and more high risk because they are out without even consider their own health and the health of other people around them. So it is common when everyone is having issues with regard to this pandemic. So it is common to have anxiety. So it is very important. The way out of anxiety or worries is actually to talk it out so that then it will lessen the burden of yourself dealing with it. Or if you not only just anxiety, you may also have depression. Again, you must actually start to open up, talk it out, and trying to get help either from professional in nature or from people who you can trust that who can give you or offer you some kind of assistance. And for those who actually experience the problem itself, being diagnosed, I think they need compassionate care, and all of us possibly need to offer that kind of assistance to the loved ones, to the family, to our neighbors, because it appears to be that now nobody is spared. So we have to actually be compassionate to each and every one of us around us. For those who have lost someone with regard to this COVID infection, so we have to also be compassionate to them. We also have to offer our support and assistance as much as we can, at least just to be there, just to possibly communicate with them so that they don't feel that they are alone facing the problem. So this is the level that we are talking about with regard to the response, early exposure. Initially, it was fear, anxiety, losing control, and then subsequently get into the situation, become the helpless, they become hopeless. They have what we call anxiety and depression. And subsequently, when it is has become a situation serious enough, they will have depression, they will have from acute stress disorder, become post-traumatic stress disorder, they have burnout, they have possibly right now reappearance of high level of stress is also very common. So this we are seeing especially for the business people, for those who are at a disadvantaged situation, this stress level will come back again and haunt them seriously. Right? And now we are looking into, I think, not only just our family, not only just the public, but we are worried actually our frontline workers and also our essential workers are the one who actually will face this situation of what we call pandemic mental fatigueness and physical fatigueness, because they are the one we've seen quite a number of people sending us and telling us what goes on and how these frontline workers in quite a number of videos that we see was actually trying to tell us to give them a break in that sense, so that all of us should be abiding the SOPs strictly to help them out because they are very tired and with regard to their work that they are facing, they are very exhausted in that sense. So here you can see also because of the load, because of the work long hours, because of possible also since they are involved with this as a front line, people are also shying away from them. The family has to shy away from them. So that also caused them to feel the distress in the situation. So obviously, as all of us have to be very supportive. So the message for today is basically, again, I think this concept of kita jaga kita and everybody must be together in the aspect. There should not be any more people or group of people who have indifferent attitude, who are careless, who don't really care about what is going on, because the message is very clear. These new strains and this variant of new strain viruses are much more virulent, much more contagious, and much more serious in the complication and the effect that they cause people who are getting infected. So Another thing that most of us should be able to look at is, unfortunately, quite a number of us are quite affected by things that they cannot control. So it's all about others who doesn't want to follow the SOP strictly, about others who don't care about the other people around them. So these are the things that distress us all. But my suggestion is that we all of us have to look into what we can control. That will be the thing that we can do ourselves. We must have a proper attitude. We must be able to follow the SOP strictly. We must be also compassionate to the people around us. We must not only think for ourselves, we must think for others around us, our own family to start with. So if we are careless enough, we become the agent that could get all these people to be affected. So I think that is my last slide with regard to this discussion. I hope we can talk about it more. We can share our own so-called experiences, since all of us have serious experience with regard to more than a year of facing this pandemic situation. Okay, so I will stop my sharing, and Felicia, it's back
All
to you.
right. Thank you so much, Prof. I think it was a very good, yeah, we compared to the first MCO and then now, I think we all learn something from experience. We all have different experiences that we can share. Yeah, I just want to go to a bit of summary before we answer maybe some questions and discuss more about how we can overcome this fatigue, right? Yeah, it's actually very interesting to take note that one of your first slides was on fight or flight, which everyone knows. Either you head on with your conflict or your fears, or you just try to avoid it. And you mentioned also freeze and fawn, right?
Yeah,
Fawn is very interesting, I think, because I think maybe a lot of us probably have gone through all four F's in this pandemic.
yeah,
We become somewhat of a not just like we freeze because we cannot we are incapable of moving or making a choice. I think we just respond. We just have this fawn response that basically we immediately from moving to try to please somebody to actually avoid a conflict, directly or indirectly. So we probably have also experienced this from our family or friends.
yeah,
And in your opinion, like if you face this with yourself, sometimes we are mindful that we are being like that, right?
yeah.
And or we are in situations where we have friends or family who is like that, who is in that stage or giving that response. So how do we go about it?
Okay, to start with, I guess as a family, we need to always communicate with each other. We need to actually understand each other, what is going on. And for those, the leaders of the family should be able to bring them together to actually suggest what actually all of us can do to help out each other. So in this case, unfortunately, some of us has become stubborn. Some of us has become very indifferent, couldn't be bothered anymore. Some of us has already become, how should I say, to the opposite side of it. Now they were talking that it's as though all these are not real, or these are
Mm,
somehow they will get some idea that we should be facing it just as it is. Like we have seen in a lot of other countries too. These are the group of people who cause trouble. So I guess if it is within our family, we should be able to work together as a family. Unfortunately, with regard to imposing things to people who doesn't want to go accordingly, that will be very difficult. That's why they use laws, and I think for the moment, if we were to see quite a number of videos, some of them were using even physical kind of attempt to stop all this nonsense. And I'm not too sure what is going on, but some people are really very, very stubborn enough not to follow and not to understand what they can do, what
mm,
they should do. So I guess that we need to use law for that. We need to use, police or those people in the authority to actually work on these people. But as for a family, we should get together and talk about it. We just cannot ignore. And quite a number of time when we had our first MCO and the second MCO kind of a thing, we will never really discuss and actually address within the family how each and everyone should and how we can survive together.
Yeah.
So I think that was never being as one of the things. But now we should, because it is more serious, it is more dangerous. So I think that
Everything's
is
tighten up.
yeah.
Right. Yeah. Thank you so much for that. Yeah. Speaking of opening up and talking about it, right? There's a question from Jess. He asked, Prof, can you kindly elaborate further how talking things out can reduce your levels of stress?
Well, basically, again, a lot of people has their own perspective. A lot of people has their own way of seeing things. Example, like, true enough, people want to talk what they have in their mind. The only thing is that, okay, to some of them, they want a person to listen how they see those things. So if we can be a good listener, if we can be a person who can, in a way, have answers to their question, to their issues, I think that is where talking out is good for them. Well, unfortunately, I guess they are seeing quite a number of situations whereby even talking out doesn't make any difference, doesn't make any changes. That's why we were addressing last time. We try to equip ourselves, all of us, must be a very good mental health facilitator to start with. And then we must be able to build ourselves to be actually a psychological first aider. So that then if we are equipped with all those kind of a thing, then people who talk things to us will feel that, we have an answers to their issues, to their problem. Quite a number of even right now, I can tell you quite a number of person who's having trouble. They develop what we call not too sure and not so distrusting to whoever that they can to start with, thinking that can solve their problem. It is because our own self, which is not really properly knowledge and properly skill to handle the problem. But talking out is actually the way out because it's no way you can just bottle things in your mind and your thoughts and you never get it out. So it's like a pressure cooker. So it will actually somehow will burst out later. So talking out is a way out in that sense, ventilating your emotion, ventilating your feelings towards what is going on. So
Okay,
that is how talking out
yeah,
is.
to follow up on that point, talking out is a way to definitely manage or lower your stress. There's also talking in a way that some people or even ourselves, sometimes we find ourselves that the more we talk about it, uh, the more we are not really finding a solution, but when we're talking about it, we also make other people stressed. So how do
Yeah.
we know that we are talking about it and really helping to sort of find a solution rather than just like talking about it and making things
Mm,
worse, right? So I think
yeah.
yeah, you can understand my question.
Yeah. I think to talk to someone who actually can make the difference is the one that you need to have to know. Because obviously you can always express your anger, you can always express your frustration, and it just bounce back to you because you cannot find the answer to that. We are seeing all this now coming in. I mean, this anger, this frustration, this so-called, feeling of, I want to say something, I want to tell how things can be done, but there was no really person who want to listen to it in a way that we were hoping that group of people should be able to listen well. This has been noted actually even among the so-called the health group professional. You can see among the epidemiologists, among the public health specialists, they will have different ideas, but it appears to be like nobody taking up the ideas. And that's where now we have a group whereby it is now negating what the other group was trying to do. So it is not getting healthy anymore. So that's why it's very important actually. Everyone should be able to listen to how people look at it, because to start with, it is not just ordinary people who's talking it out. So if those people are very important for us to take note, we should not just leave it that way. That means they are talking as though they are talking to nobody. They are talking to nobody listens to what they want to say. Again, for other lay person, obviously, if you want to talk things out, try to find someone who can really help you better. But I think just simply say it out things also can help you to reduce the stress. So only the problem is you may not get the answer. So after you say a few times without getting the answer, you become more and more frustrated. That could actually cause a lot of trouble to the person who was looking for the answer, but they never get the answer clearly, how they can work this thing out. I think like the small business people, and nowadays they become more and more frustrated
Yeah.
with regard to what is going on, with regard to the non-uniformity in the sense of the dealing of the problem. If you were to understand, quite a number of people are frustrated because some people get away with it, some people get into trouble, some people did not really listen well and not support, but others may get it. I think these are the issues. And now with regard to vaccine itself also, we can see the issue of who gets it and uh, how things are going. These are all things that we need to consider seriously.
Yeah.
Yeah, we have to understand the problem, but if we have a proper forum discussion, how things should be done, I think that is much better, because I think even vaccine already become a serious problem with regard to distribution, with regard to who gets it, how they get it, and things like that.
Yeah.
These are the
That,
issues.
it's like maybe the key is like don't be part of the problem. If you're not part of the solution, then you're part of the problem, right?
Mm.
Yeah.
All of us have reached a stage whereby this is where we call it mental fatigue. We become more and more irritable, more and more aggy, more and more easily emotional, very sensitive. So they should understand this situation. So people should know how to actually handle and manage this. I'm not too sure whether they really sit down to talk about it, because it's easy to control the physical or the structural issue. It takes quite a serious group of people who supposed to manage all this to understand how to actually manage the emotion and the psychological part of people. I think that is what we are hoping for. Who are this group who should be actually able to? Because it doesn't seem to be there.
Yeah.
The psychological assistance, it appears to be like we're not too sure who can really, or how are they moving all this group of people to handle people frustration.
Yeah.
So I think it's as though like we are fighting the battle with either we got medication or we got vaccine, and we do just a simple SOPs, and we forgot about the emotion part of people. And that's where we can see a lot of negative kind of behavior is coming out from people, because that was not properly addressed.
Yeah, because emotional health is you don't see a cut, you don't see a wound, you don't see them bleeding, right? So it's not,
Mm.
but it doesn't mean that it's less than a physical pain or injury.
Yes.
So yeah, hence why I think we should. One of the reasons I think this session was created for that. I mean, we've been doing this actually pre-pandemic, but during the pandemic, we are all connected online.
Mhm.
And yeah, and so we see quite a few people are actually in. Yeah, we want to open it up for discussion. If let's say you'd like to ask a question or express your opinion, you can also unmute yourself, and or if you're a bit shy, you can always type in the chat box. We are also on Facebook Live at the moment. So yeah, let's open it up for our last 10 minutes. So we try to always keep it to about 1 hour. And yeah, we want to welcome all the participants. I think, yeah, I think everybody is looking for an outlet. it's good, whether you come in by invitation or just curiosity. I think it's good to be on this platform, because we are actually trying to be part of that solution to educate each other and keep each other informed of how to handle and manage, during the pandemic, especially emotional health.
Yeah. Yeah, welcome everyone. Anyone who want to share?
Yeah, you can unmute yourself. All right, okay, there's a question. So, all right, okay, Prof, what is your opinion regarding too many fear-mongering messages circulating around social media? Some like to forward and then they get affected by overthinking, especially they lock themselves in the room, easily irritated, having anxiety, and some I managed to convince them to seek professional help.
True. Okay, with regard to all these so-called media news and things like that, we should be individually, we should actually equip ourselves to be able to filter all those messages, all those news. If ever we can't, we should look for answers with regard to only those who can give a better answer to what is going on. There's always this group of people who are creating trouble by giving quite a number of news against some of the news. In that sense, they're not too sure what is going on, why they are putting up that news. Are they really wanting to scare us with regard to what this fake news kind of situation? But I think we don't know them, but we don't know who they are, but we know that they are the one who create all these kind of fake news, or even according to them is a real news. But we are the one who's supposed to know and how to select what is right, what is wrong, what should not. So I think to safeguard ourselves, we need to equip ourselves with a proper understanding. So that's why, if possible, try to find answers to someone who can give you a much better answer. That's why they keep saying about all these fake news. First, clarify the news, find out what is going on. But a lot of people are now in a situation of what we call when they are themselves emotionally distressed, or they can easily become hyper suggestible. They accept things without even thinking about the logic of it, or the issues is whether it's proper or not. Because like even like this morning, I thought I saw somebody was there was a message that the cases are go beyond 10,000. When it is only still about 6,000 new cases for the day. But it came out to, I got one message, it's now 10,000. Then subsequently, then we got another news, it's only 6,400 or so. So I'm not too sure what kind of people who put this thing up easily and then spread it out for all of us to see. But initially, we also be taken up by that news as though like it is real. But again, as it does affect you. It does affect how you see those things. It makes you fear. But later, if you can actually control yourself, you don't actually end up like become so fearful, get stuck within your own emotion, become more and more hyper suggestible with a lot of things that possibly not right at all. I think we need to develop ourselves to be more able, strong in the way that we respond to situation. I think that needs in the way that our forum here, where you can always look for a person who can give you an answer to your question, a better person in that sense, not just simply, believing in anything.
All right. Yeah, I think that's really good. You have to be discerning enough to verify the news before we forward them, and then this is actually quite interesting. We were talking about this on Friday, and one of our friends said there's actually this website called sebenarnya.my that actually helps you to verify fake news versus real news. So it's like the slogan is basically like tak pasti jangan forward, or do not forward unverified news. So I think that's good to educate people and starting with ourselves, you know. First we calm ourselves down and then not forward before we verify the news.
Not only that, you'll be surprised. One of the big issue is about the vaccine. Even among us, the medical people, the supposedly knowledge and learned per person, they have a lot of their ideas with regard to the vaccine.
Right.
They still propagate, issues with regard rather negative towards the vaccine in that sense,
So
with a very wrong understanding. So these kind of people is the one that we are worried because people look up upon them. Example like this mRNA and DNA. We are quite surprised how could even doctors doesn't want to get the vaccine because they still believe mRNA will change the DNA, whereby we know mRNA is just a messenger RNA. It doesn't work and actually change the DNA. So, and somehow these people is the one who bring up as though they are in authority. And now people are, quite a number of them don't want to go for the vaccine, and that end up with, we have trouble with herd immunity. So I think this is the worst group. The one that's supposed to be people look up upon them and they influence people negatively with the way they look at it. They must have their own other agendas and whatnot. We don't know.
Right. Yeah, that's the power of social media, but there's a pros and cons. You can spread out message. Sometimes it's not towards the benefit of others. It creates fear, and it's not a right thing, definitely. Yeah, there's another question.
Yeah.
Looking at the current problems, Prof, a lot of it is beyond our control. What helpful strategies could you suggest so those or these stresses are under control? I think you shared about something, what you can control and what you cannot, right? Yeah.
Yeah, the last slide is about that.
Yeah.
Basically, the last slide is about what you can control. That's the one you dwell into. What you can't control, there's no point trying to dwell into it. I mean, you can't try to change people the way they want to say things. They have their own mind. There's no way you can impose anything on anyone. If they don't want, that's even worse. To actually understand us. So look at what you can control. To start with, look at yourself. If you're easily become fearful of the news, try to understand that why you become fearful of the news, why you cannot accept certain things and you believe it so strongly. It is true for that. So I guess if you did not realize that part, and this is why I said most of us who are having trouble are people who are actually quite vulnerable and having some kind of inadequate element within themselves to be resilient, to be able to look at it in a much a positive manner. So if you think that you have that kind of a nature, that's why you must get someone to assist you, someone that you think can really make that difference. That's I think like the forum that we have here with your group in KL and things of that nature. So I guess we can try to call them up, get in touch with them, and get some answers to it, rather than just take it as it is. Because this is the one nobody actually make you unless you allow it that way. So I think again, as I said, it is all depend on how you want to see it, how you understand it. But people can be so convincing. It's as though like things are very true. So I think I also actually at times fall into that kind of a trap without actually checking, without really looking for much more better information and things of that nature. So, but the thing is that just control yourself not to easily uh, become oversensitive and emotional about things.
Yeah, managing oneself, it's the key, I think. Yeah.
Yeah.
All right.
But to manage oneself, you must know what you want to manage. Without knowing your weaknesses, without knowing possibly your personality, your trait that you have, maybe you can't even make any difference. So that's why you must know your strength and your weaknesses.
Right. I think that's a really good way. I think we all learn how to manage and things that it's beyond our control, we must know our strengths and weaknesses and know how to make it work for us. Yeah. For personally, I find that because we are so overwhelmed with social media information these days, I think it is okay to not dwell in obsessed with like what is the numbers today, or if you find certain things that you read online or the certain people that you follow online is giving you the trigger, it's okay to mute and unfollow. That's how we protect ourselves, because our mind has no gate, right? So we have to protect it. We have to know where our triggers is. Yeah. So yeah, that's some of my practices, and it works. Sometimes I think press pause, unplug for a while, and then come back again. It's okay to feel a certain way. It's okay to be to feel vulnerable. I think most of us try to distract ourselves, keep busy, but at some point we need to face it, and in a more constructive way, rather than just trying to sweep everything under the carpet. One day you will all burst out like a volcano, right?
Yeah.
Right.
I mean, you can contain your emotions,
Yeah.
because the longer you try to contain the emotion, that is where the trouble, brewing within yourself, and you can easily become, so much distress, end up with a lot of psychological complication. So that's why talking out is very important. Looking for avenues where people listen, and you can actually trust a person who listens to you. I think this is where we're trying to bring up the group of people who can actually make that kind of support. If you know, then you better always communicate with this group of people rather than just take anyone as though they are whatever they say is the whole truth, nothing but the truth. So that kind of thing.
All right. Okay, great. So just to summarize, I think today we spoke about pandemic mental fatigue and how prolonged symptoms. I think stress itself is not a bad thing, but when we do too much of it, or it's a prolonged stress, it becomes something not so good, and we have fatigue, we have exhaustion, it becomes a burnout. And it's a very common thing now that we have experienced 1 year of pandemic, and most of it would be like under lockdown and under working from home situation, where all senses are heightened up. So now we are learning on how to lean on each other, be more well informed, be mindful, know your strengths and weaknesses, know what triggers you, ask why. I think being mindful is the key. And what Prof has shared is to focus on what you can control, and not focus on what you cannot control, because obviously that's beyond our reach, right? And we want to thank you everybody that has actually came online. I think hope all of you have benefited, and definitely look forward to our next session. Yes, thank you so much. There's Sugu, there is, let me just there is Dato' Mbai, there's Fatin, there is Jess, Karthik is here. He's actually from a book club. Nurhani, Nurin, Dr. Shakir, there's Wan and Wani. And Coach Francis. So we are actually from FIT unit and PRKPP. Hence why we're bringing this session, Ask the Experts, to talk about emotional health, mental health, physical health, and becoming more well-informed, and educate ourselves on a more serious topic, but in a very light-hearted manner. In a way, we are all very, we're all open. If you need somebody to talk to, we have Prof Mohammad, that you can always reach out to him on Facebook or via WhatsApp. We are all here for that support. And I hope we can continue this session since you'll be home for a while. So I think that's something that we need to adapt. We are definitely in the new norm. 2021 is here. We are moving on, but with a more support, I believe. Maybe we can all turn. Some of us can turn on our video camera, so we can take a class photo, a group photo.
Just to tell you all, basically we have to actually be prepared for another 2 years or so with this kind of situation.
Yeah.
Even though we have vaccination, we have because the virus is not static. The virus actually keep moving and keep changing. So our vaccine also might not actually work very well. Now they are talking about third booster dose. So it just says that basically it will go for at least 3 years to 5 years. We have to actually brace this kind of difficulties.
All right, so everybody is on. Oh, Dr. Shakir is on two screens. All right. Thank you so much for tuning in. Okay. Yeah, we have actually 14 people, and also like there's a few people on Facebook as well. But it's okay. We can just take a screenshot. Okay, give us your biggest smile. All right. Okay. Thank you so much. So let's keep each other informed, and we'll see you next week. You can follow us on Fit Unique Facebook page. You can also follow me on Facebook and Prof Mohammad. And also keep an eye on the link will still remain the same for the next week. If there are no changes, we will be back next Saturday at 9 p.m. And I hope you stay safe, stay home. Yes.
Any topic that anyone want for us to discuss, maybe you can just tell us so that I can
we are on our WhatsApp group as well. So definitely we are open to suggestions, any topics that you wish to you want some highlight on, and you want some you want us to discuss, then it will be a very good topic for us to bring next week as well. So we do take in feedbacks, and yeah, we hope to see you soon. So stay safe. Yeah. Have a good weekend, everybody. Thank you so much, Prof.
Bye.
Okay.
Bye.
Thank you.
Bye.
Thank you so much.
Thank you.
All right. Thank you.
Bye, everybody.
Okay, Prof. Thank you. Good night.
Good night.
Assalamualaikum.
Okay. Waalaikumsalam
Stay
warahmatullahi.
safe.
Stay safe.
Bye-bye.
Good night.